Hello, this is CMD Nova. Today I am proud to introduce CyberMD Care's Enterprise Workflow Optimization and Documentation Support Infrastructure, a platform designed to support independent physician associations, IPAs, operating under capitated or shared risk arrangements. Our infrastructure is intended to help IPA organizations improve documentation workflows, streamline administrative processes, and support internal audit readiness, subject to each organization's own clinical policies and compliance requirements. Across California, IPA Networks collectively coordinate care for hundreds of thousands of Medicare Advantage beneficiaries, supported by distributed clinic networks and delegated administrative teams. In delegated risk environments, IPAs bear substantial responsibility for utilization management, documentation accuracy, and quality performance. Avoidable utilization, unresolved care gaps, and insufficiently supported documentation can significantly affect RAF outcomes, resource planning, and compliance exposure. Manual chart review, quality measure tracking, and documentation validation often create heavy administrative burdens across clinic sites. Most critically, incomplete medical documentation and unsupported coding indicators introduce audit risk during CMS-HCC risk adjustment reviews and payer audits. To support IPA care management workflows, our application collects patient-reported and device-generated wellness information to support, but not replace, clinician assessment and in-person or telehealth encounters. By capturing patient-reported pain context, P, structured questionnaire responses, Q, and biometric wellness telemetry, R, the PQR data system organizes raw information into structured summaries intended to be configurable against customer-selected quality measures and applicable CMS and NCQA specifications, as interpreted by the IPA's compliance and clinical teams. This workflow enables IPA operators to support proactive care management and efficient resource planning under capitated arrangements. Patient-reported and device-generated data is periodically analyzed under configured workflows to support clinician review and care management prioritization. While the platform is not a substitute for emergency services, configured alerting may route selected readings to designated clinical staff according to customer protocols. Our integrated BioSignbox trademark protocol supports identity assurance and auditable data integrity workflows under HIPAA supportive safeguards, clear notices, applicable consent or authorization where required, and retention controls. Within our architecture, each documentation prompt or review item moves through a configured workflow lifecycle governed entirely by the IPA organization. To prevent unresolved workflow backlogs if no affirmative clinician action occurs within a configured window such as a 30-day threshold, the item may be marked as expired or closed for workflow purposes while strictly preserving required system logs, audit records, and federal data retention obligations. Fragmented, patient-generated metrics are organized into documentation records that may assist internal audit preparation and documentation review. Our risk adjustment documentation review support engine generates non-binding condition category or documentation prompts for clinician review under the applicable CMS-AHCC model version for the relevant payment year, including V24 and V28 parameters where appropriate. This provides clinical context for internal review at the point of care, delivering a verifiable data integrity trail to support documentation accuracy and audit readiness. Workflow risk tiers are generated preliminarily for clinician review to prioritize care management. To support data minimization, the underlying model processes demographic attributes using secure account-linked variables, specifically configured management IDs, gender, and age under strict HIPAA safeguards and applicable BAAs. These prompts are not diagnoses, not HCC codes, and not billing recommendations, and must not be used for claim submission without independent clinician validation and compliant documentation. During transitions between CMS-HCC model versions, the engine presents non-binding documentation prompts prior to final EHR entries, reducing the risk of documentation omission. These clinician-reviewed documentation prompts are accompanied by non-financial context summaries, allowing providers to track information relevant to quality measures prior to formal clinical attestation. Our framework operates strictly as an advisory tool, not automated coding. No code is selected, inserted into the EHR, or used for billing without independent clinician validation. Clinical judgment and final coding decisions remain fully with licensed clinicians, and every user action is preserved in an audit log supporting data integrity review. The platform does not estimate, predict, optimize, or guarantee reimbursement, RAF scores, capitation, shared savings, or payment outcomes. The platform supports selected value-based care documentation processes. Raw patient-reported data may support clinician-reviewed annual wellness visit and health risk assessment documentation workflows where applicable to the IPA's delegated program. Rolling trends assist cohort identification for high-prevalence conditions such as hypertension, diabetes, CKD, and CHF, helping to support systemic compliance and assisting quality measure tracking in accordance with NCQA HEDIS specifications, as implemented by the IPA. CyberMD Care delivers regulatory risk controls designed to support clinician review, privacy, and documentation integrity. By enforcing strict clinician validation before any coding or billing use, the platform mitigates compliance exposure while ensuring that clinical judgment and final liability remain fully vested in the clinician's independent attestation. By minimizing direct identifiers where feasible, omitting unnecessary names, social security numbers, or addresses, our risk reduction architecture is engineered to minimize privacy risks and protect data under HIPAA supportive standards. Our DSM Inference X engine is designed to help bridge the gap between raw patient metrics and strong data integrity controls. It is intended as a robust infrastructure component to support IPA care management workflows, streamline quality measure documentation, and reinforce audit readiness. It does not by itself establish clinical accuracy, medical necessity, legal admissibility, CMS acceptance, or RADV sufficiency. Those determinations remain with providers, payers, and applicable regulatory bodies.